Welcome back! In today's video, I'm going to be sharing with you my philosophy. What is my philosophy? Skills before pills, but sometimes you need pills to build skills and then use those skills to get off the pills. So what exactly does that mean? Am I against medication? Well, no. And so in this video, we're going to break down my philosophy, starting with number one, skills before pills. So it's always best to utilize skills or preventative measures first before going directly into pills when you're faced with a mental illness. And in fact, it's better to actually establish a mental wellness routine before you even get into a mental health crisis or an event ensues in your life, such as the loss of a loved one, you lose a job, etc. That can precipitate mental health problems. So these preventative skills include things like building resilience. And resilience is multifactorial and requires its own video, so stay tuned because I'll be making a whole video on resilience. But building resilience is a preventative measure, as well as using skills such as diet, yoga, meditation, exercise, and things of that nature. It's also understanding and utilizing your resources and having positive social connections. So skills can also be used as secondary and tertiary preventative measures to abate the mental illness and prevent it from getting worse. And these types of skills would be things like cognitive behavior therapy, interpersonal therapy, relaxation techniques, guided imagery, EMDR, and many more. So, number two, sometimes you need pills to build those skills. Let's face it, not all of us were taught ways to help establish our mental wellness. And if you don't have a mental wellness routine or things that you do to help prevent mental illness, then you're going to be more at risk for depression and anxiety when environmental stressors come your way. And if you don't catch it early on, that mental illness or that environmental stressor that can cause a mental illness, that can actually progress to a severe form where medication or even supplements may be required to treat your symptoms. So pills, including supplements, they are not magic bullets. Okay? Because pills alone in most cases will not remit all of your symptoms of mental illness. And because a lot of times the root cause of the mental illness is overlooked. So pills and also supplements are actually used as band-aids, and they're used to help reduce the symptoms while the integrative medicine provider or functional provider look for those root causes that we discussed in our video on root causes of depression. And in many cases, these pills are only used temporarily, like 6 months to 2 years max. And this would depend on the person's situation, internal and external factors. Which brings us to the third part of the philosophy. Then you use those skills to get off the pills. Well, as you learn these skills can actually help to change your thinking process. They can help to switch you from a negative to a positive mindset, and you can learn how to de-stress on demand and relax. When this happens, you can actually then start leveraging those skills to then taper off the pills. But why would you want to taper off of pills? Well, you would want to primarily taper off of those psychotropic medications, antidepressants, antipsychotics, etc., because they can actually lead to neuroadaptation, which I talk about in antidepressant withdrawal syndrome, and they can also lead to something called antidepressant poop out. So what is that? That's when your antidepressant, if you're taking it chronically long term, say 5 years, 10 years, eventually you get to the max dose and you're on that max dose, and then that max dose doesn't work anymore. So what happens? Well, the traditional provider will add another medication, try to go above the max dose, and when that doesn't work, they just continue adding more medications. What this does is it leads to polypharmacy. And what is polypharmacy? Well, polypharmacy is actually when you're on more than 4 medications for the same disease. So a lot of times what you'll see is someone who started out with depression is on an antidepressant, a second antidepressant, an antipsychotic, an anxiolytic, and a hypnotic to help them sleep. So they end up being on 5 and sometimes even more than 5. Sometimes a mood stabilizer gets thrown in there and now they're on 6 medications. It's insane. And what happens is that now they become neuroadaptive to all of these medications and chemicals in their brain. They end up becoming worse than they first started. They end up being treatment resistant and have to take other measures in order to treat their symptoms. It also increases their risk of side effects because imagine, now you're on 5 or 6 pills, and so that increased risk of side effects is a lot greater. And it's important to stress here that tapering off of medication shouldn't be done alone. So if you're one of those patients who have been on psychotropic medications for a long time and you're thinking, geez, I need to taper off, please do so under the direction of your provider because this is a very slow process. And if you have a provider who's trying to taper you off too quickly, like say in 1 month, switch providers. You need to find a provider who is trained in how to decrease and how to withdraw antidepressants slowly and safely, but who will also look for root causes of the disease to begin with to help mitigate that and which will lessen your withdrawal effects. Also keep in mind that tapering off medications is not for everyone. When we're talking about tapering off of medications, this is typically the case with someone with depression or anxiety. But when you have cases of bipolar depression or schizophrenia, many times tapering off medications is not an option. However, you can actually use those skills to get to the lowest dose possible to still treat your symptoms. And so therefore, you won't have to continue going up in dosages to manage your symptoms because you'll be able to manage your symptoms with the skills that you've learned. And so there you have it. That is my skills before pills philosophy. What do you think about it? Let me know down in the comment section below because I'd love to hear your feedback. And if you're struggling with your medication regimen, perhaps it's not working, or perhaps you feel like you're one of those patients who's been on medications for way too long and you don't know what to do about it, please give me a call and we can talk about a way to safely taper you off of your medications. And this doesn't just include antidepressants. This also includes the anti-anxiety medications like benzodiazepines, which oftentimes causes patients to be worse off than they were when they first started taking the medication. And if you missed my videos on the ugly truth about benzodiazepines or how to withdraw safely from benzos, please go ahead and check those out next, and I'll look forward to seeing you next week.